Good day, ladies and gentlemen. My name is Juliana. I will be presenting the assessment of knowledge, attitude, and perception of people living with HIV regarding TB infection control in Agege, Lagos State, Nigeria. So, the, the outline of my presentation, be taking the introduction, the statements of the problem, justification of the study, the methods, the results, the conclusion, the recommendation, the direction for future research, and the references. So, the introduction. The truth is, human immunodeficiency virus (HIV) has several opportunistic infections, but TB remains the leading cause of death among people living with HIV. About one-third of the world population are infected with latent TB, which implies that these people are actually infected with latent TB, but they are yet to be ill and they cannot actually spread the disease. Then those that are infected with TB have 10% lifetime risk of falling ill, while those people that are immunosuppressed, such as HIV patients, diabetes patients, and all other immunosuppressive conditions, have higher risks of falling ill. Then HIV increases the chances of TB infection amongst people living with HIV. Moreover, TB is very infectious and its causative organisms is spread from one person to another through inhalation when an infected person coughs or sneezes or spits saliva out. Unfortunately, people living with HIV who are not on treatment have the ability of infecting 10 to 15 other people that are their close contacts within a year. Research also shows that, on the average, 45% of HIV-negative people with TB and nearly all HIV-positive people living with TB will die if not properly treated. So, which implies that it's important to actually treat TB as early as possible. So, the statement of problem. In 2001, the United Nations declared HIV/AIDS as a global emergency, which is of devastating impact, and also stated that the morbidity and mortality relating to TB and HIV were expected to increase significantly in future. TB is a leading cause of mortality and morbidity among people living with HIV. And as at 2015, HIV prevalence rate in Nigeria is estimated to be 3.1%. Although TB-related deaths among people living with HIV had fallen since 2004, but TB still remains the leading cause of deaths among people living with HIV, and it accounts for one in 3 AIDS-related deaths. TB and HIV are actually entwined and they fuel each other, and together they make up the leading cause of mortality globally. Co-infection, TB-HIV co-infection actually accounts for about 30 to 40% of deaths among those who are infected with HIV. So, for the justification of the study, TB-HIV co-infected cases treated with first-line anti-TB drugs. Some are treated with the first-line anti-TB drugs, but some other studies stated that patients on both anti-TB and ART tend to have poor outcome compared to those who are not. And they also stated that it could be due to so many reasons, including poor counseling, drug toxicity, adverse interaction between the ARVs and the anti-TB drugs. So knowing all this, that being on both treatments also has poor outcomes. It is therefore better to prevent the TB-HIV co-infection. Hence, the goal of my study was to assess the knowledge, attitude, and perception of people living with HIV regarding TB infection control in Agege local government area. So the objective of the study were to assess the level of knowledge and awareness of people living with HIV about TB infection, to evaluate the attitude towards preventive measures taken by people living with HIV in order to reduce the risk of contracting the TB infection. Then to identify the perception of people living with HIV on TB care and treatment. So for the methodology, the study location is Songo PHC, which is a comprehensive HIV care and treatment center in Agege. The facility also has a TB dot center for treating people infected with HIV, all forms of susceptible TB. Then the study population is people living with HIV enrolled into care, which also includes those that are either about to be commenced on ART or those who are already commenced on ART. Then the study design is a cross-sectional descriptive study. For the methodologies also, the inclusion criteria included HIV positive clients enrolled in care and are either started on ART or yet to commence ART, but had never been diagnosed with TB or commenced on TB treatment. So for the exclusion criteria, HIV positive clients who were previously infected or currently infected with TB at the time of the research. All these people were excluded from the study, and this was done to reduce the risk of bias as a result of personal TB experiences while answering the question. So for the data analysis and ethical approval, data analysis was done using SPSS version 20. Then the level of statistical significance, the p-value was less than or equals to 0.05. Then ethical approval was sought from the Lagos State Health Research and Ethics Committee in Agege. The results of the study showed that 71.9% of the respondents were aware of TB, but they, however, didn't have as much knowledge as they ought to. They were aware, but they were not knowledgeable regarding TB infection control. Then only about 123 respondents had fair knowledge of TB. They had overall knowledge, of TB infection control. And out of the 123, 75 were females, while 48 were male. And there was statistical significant association between the gender and the knowledge of the respondents. The study also found out that the mean level of attitude of the PLHIVs toward TB infection control was fair at 55% of the respondents, with 2.4 being the mean value. Then, Then 51.7 had good perception of TB infection control, while the result also revealed that there is no significant difference between the level of knowledge of participants and their educational qualification. Differences were also observed in the knowledge score and educational qualification of respondents. For the discussion, a total of 345 respondents participated in the study. The age range of the respondents were between 16 to 51 years, with a mean age of 34.4. Then majority of the respondents fell within the age of 25 to 35 years, which is in line with the study conducted by Eze in 2009, where it was found out that a large number of HIV infection was found out in patients between 15 and 49. The study also revealed that 53.9 of the percent of the respondents got to know about TB from the health facility. But beyond awareness of TB, there is need for in-depth knowledge of TB infection, prevention, and control. Findings from the study also revealed that majority of the respondents were aware but still lacked adequate knowledge regarding TB infection control. Therefore, there is need for more health education, especially for people living with HIV regarding TB infection. This finding also showed that majority of the respondents were employed. Therefore, income has become a contributing factor to risky behavior, which can lead to HIV infection transmission. However, the emergence of HIV and AIDS subsequently led to increased risks of TB infection. So, in conclusion,
Hello, Juliana.
the findings from this study
Hello,
reveal that
Juliana.
despite the relatively fair perception and attitude towards
Hello,
TB infection
Juliana.
control by people living with HIV,
Uh, there
there
is
is a
2 more minutes
poor
more. Okay, please
knowledge
conclude
about
your
TB infection
presentation.
and control. Okay. Okay, and results also showed majority of the respondents were aware of TB but still lacked adequate knowledge about TB. Then everyone living with HIV, especially those that are infected with TB and those infected with TB, should be given adequate information to improve knowledge regarding the major causative agent of TB. Then the recommendation: health education, especially for those living with HIV regarding TB. There is also need for health workers to at the triage station to carry out the TB screening to give adequate information to this group of people, which will eventually lead to behavioral change. Then there is also need to strengthen awareness on TB infection control and improve the accessibility of healthcare service targeted towards people living with HIV, especially men, since it has been observed that women generally have better health-seeking behavior. Then the recommendation to the local government and the officer in charge of the health facility should be to build the capacity of health workers by providing them with skills for better client education. Then direction for future research. There is need for in-depth knowledge about TB infection, prevention, and control. Hence, health education focused on bringing a significant change in the knowledge of TB must be stepped up amongst this study population and within the TB control program so that they can be scaled up to other similar health facilities. Few studies have been carried out, especially in developing countries like Nigeria.